I'm Terrence Grant, reporting for InfoWars from Calgary, Alberta, the heart of the North American Union's oil industry. In January, InfoWars showed you how Big Pharma didn't want a cure for cancer because it was too cheap, and they couldn't gouge people who were dying as well as their families for all they're worth. Dr. Evangelos Michailakis of the University of Alberta showed that dichloroacetate, or DCA, a relatively mild drug, actively reduced human cancer tissues outside the body. Dr. Michailakis and his team are currently engaged in clinical trials on humans, but funding for research is not nearly what it should be for a breakthrough of this magnitude. When the University of Alberta released their findings, the news generated a lot of prostitute coverage as it was something too big to ignore. Fox, CNN, MSNBC, etc. covered it. This coverage, of course, died out very quickly, and nothing much has been heard since, besides the odd story. Meanwhile, clinical trials have been ongoing, sorely underfunded. Some brave souls are keeping the torch of humanity alive. Doctors who are willing to treat people for how it feels in their hearts instead of in their portfolios. We go now to Dr. Akbar Khan, who has treated over 900 patients using DCA. I'm sure he'll have interesting things to say. Dr. Khan, I'm interested in what attracted you to dichloroacetate as a possible treatment for cancer.
Okay, well, back in 2007, when University of Alberta released their first paper on DCA, which showed that it killed breast cancer, brain tumors, and lung cancer, the publication generated a lot of media attention, and there was a newspaper article, and then a patient actually brought us a clipping and said, have you heard of this drug? And we were very interested in it. And so I looked at it, and I said, well, you know what, I actually never heard of this drug before. It's not a drug that's in common use, but let's check into it and let's see what this is all about. Is it available? Is it legal, etc.? So that's really what got us started, by patient request.
Now, I was wondering how DCA could be administered within medical regulations, given that it is not considered as a conventional treatment for cancer.
In Ontario, in our province here, DCA is approved for treatment of congenital lactic acidosis. That's the standard disease that this drug is approved for, but we're not using it for a different disease. And that's what's called off-label use. And off-label use is something that's done all the time in medicine, and it's allowed and it's considered acceptable, provided that you have some sort of scientific rationale for using the drug for the other disease that it's not approved for. Well, in the U.S., the regulations may be different. I think it varies from state to state. If DCA is approved in a particular state for treatment of congenital lactic acidosis, then technically it is legal to prescribe it for cancer.
Okay, so now I'm trying to get a feel for why DCA treatment is not more widespread, given that these studies were done 5 years ago.
Just the fact that it works in the lab, most doctors will look at that and say, well, you know, that's not really enough for us to believe that it's going to necessarily work in humans, so we're not interested in it. So one is there's a lack of interest because, like I say, you know, many drugs don't work. And then the other thing is the research that has been done in humans so far, I mean, up to this point today, is also limited.
The lack of research is basically due to lack of funds.
That's right.
I know that Big Pharma doesn't really want to invest in it because there's no patent available for it.
Yeah, that's exactly the case. Since there's no patent on the drug, it means anybody can manufacture it, and the cost of the drug can be brought down quite substantially.
I go on your website and I see that 44% of your patients were so far along that they died within 4 weeks of starting the treatment due to their pre-existing condition.
Yes.
Now, could DCA be a viable option for someone with an early-stage cancer? Do you think that they would respond better?
Well, I think they would, and it probably would be a good treatment option. But at that point, then you do fall into a bit of an ethical dilemma that, you know, here's some conventional treatments out there which are proven, treatments that have been well studied, like, let's say, chemotherapy, for example. And then you have DCA, which has not been well studied. Is it okay to offer it at that stage? Our position is we don't routinely offer it at that stage, but there are patients out there who have already refused conventional therapies based on their own philosophy and based on, you know, assessment of what the risks and benefits are for them. And if they've already refused the therapy, in that case, then we do sometimes offer the DCA to those people with early stage disease.
Now, I've heard that it's a gentler treatment. Are there a lot less side effects when compared with chemotherapy?
Oh, definitely. With DCA, there's really no life-threatening side effects that we've seen, and there's really nothing reported in the literature either. And compared to conventional chemotherapy, that has many any life-threatening side effects.
Yeah, people I've seen taking chemotherapy, it almost kills them more than the cancer.
Oh yeah, well, not only almost. I think there is a large number of patients that do die as a direct result of chemotherapy every year, and the statistics are out there. I don't know exactly what the numbers are, but people do die every day of infection, which is a direct side effect of chemotherapy.
Now, Dr. Kahn, out of the 900 plus patients that you've treated with DCA, can you tell me about some of the best responses you've encountered?
We've had a few cases of very dramatic response, and actually we've just submitted our first such case publication, which is a lady that we treated over 4 years ago for a metastatic kidney cancer. It was sort of a rare type of kidney cancer that is spread through her body. We treated her with DCA, and it was combined with a dose of radiation, and she's completely disease-free, going on 4 years now.
Wow, that's awesome.
Yeah, that was our first case of very dramatic result, and we've had a total of now about, I think there's 5 cases that are like that, where very dramatic result and completely unexpected disappearance of cancer.
Some people have touted DCA as a cure for cancer. I'm not sure that it's a cure in itself, although I do believe it's a very important tool. I'd like to know what other treatments you combine it with.
Yeah, I do agree. I don't think it's considered a cure. I mean, most of our patients, as I say, they improve with it, and we've had a very small number who are cured. I think in combination, that's probably going to be where you get the best results. Now, at this point, we don't have enough data on what are the best drugs to combine it with, but we do know that with radiation, we've seen many patients have very good results in combination or when the DCA is given soon after the radiation. With certain chemotherapies, there is definitely an improvement in cancer cell kill. And then there have been some other drugs, some non-chemo drugs that we found that DCA worked well with. And then there's benefit with combination with natural medicines as well, vitamin C, for example, alpha-lipoic acid, and perhaps curcumin, and several others as well.
That's excellent. Now, you mentioned that it's a lot cheaper drug, so basically therapy in total, even with the combination of everything, would still be cheaper than conventional?
Well, therapy right now with DCA, at least at our clinic, it's a few $100s a month, so it's not terribly expensive.
Gee, that's what I spend on coffee.
Yeah. Yeah, it's not that bad. And if you compare against certainly against the patented cancer treatments, the proprietary treatments, those run in the thousands per month, and that's per drug. So if you're combining 2 or 3 drugs, you could be talking 10 or 15,000 a month easy. Hopefully insurance or the government pays for that, because most people can't afford that.
So do you believe that Big Pharma is actively suppressing research into DCA because it's too cheap, or are they just ignoring it because there's not enough profit to be made from it?
Well, I haven't seen any evidence of anybody suppressing it, but I'm sure there's no interest because there's not much profit to be made. Mm-hmm. Yeah.
What do you see in the future for DCA?
Moving forward, I think there's going to be an increased interest among conventional physicians, probably based on some of the new publications that are going to be coming out. And some of them will be, I think, from us, and I've also spoken to oncologists in the States who have also good experience with DCA, and also family physicians like me, both in Canada and the States, who are using DCA, and I'm encouraging them to publish as well. So hopefully that will, get doctors more interested.
Now, what could our audience do to help further the research?
I guess I would encourage the audience, if they have any novel ideas as to how the research could be funded, then they need to get the word out. Whether it's asking government to set up a funding program for these orphan drugs, or whether they can come up with other innovative methods of funding the research, I think that's really what we need to have done. Because once the research gets done, then the drug will really catch on among oncologists around the world.
Thanks for being with us today, Dr. Kahn.
No problem. Take care.
Well, there you have it. Big Pharma would rather kill you with their toxic cocktails that cost $10,000 or $15,000 a month than let you pay a few hundred for a mild treatment that actually works. What are the so-called humanitarian organizations that pledge that they seek freedom from cancer doing? With the unbelievable amount donated to these organizations every year, DCA therapy should be a reality for everyone. I guess the Marley and Scrooge medical industry must want the Cratchits to get a loan to pay for Tiny Tim's cancerous leg. This is Terrence Grant reporting for InfoWars and Prison Planet. Keep up the fight, InfoWarriors.